Hello there and welcome to the clinic. Just to double check here, are you here for the medical full body exam? That includes like a cranial nerve exam, head to toe exam, and detailed medical tests. Great, welcome to Drew City Clinic. I am Nurse Selene. Are you okay with me being your nurse today? Good. Relax on the medical bed in front of me as well. If you're okay with me being your nurse, please confirm that. That is me. Great. Pleasure to meet you. Yes. I'm going to pull a chair up. And it looks like today, let me check myself in really quickly on the computer. Just gonna scan that. Okay, and log myself in. You're here today for the full body exam. Well over 3 hours long, is that correct? Good, we'll have several medical professionals examine you today. I'll be the one that starts. Great, if you need another nurse at any point whatsoever, just let me know and we'll switch them out. Okay. Can I quickly get your first and last name before we begin? Okay, how do you spell that? Is that with an I, an E, or a Y? Okay. And birthday with the year? Okay. What does that make you? Is that a Sagittarius? Was I close? Okay. And last questions. Do you have any allergies we should know of before we begin? Okay. I'll write that down. And I'm just going to tell you how this exam begins and works. Could you first look at me? May I touch your face? Okay. Relax in the medical bed. We're going to perform something called a full body exam. And we're just double checking to make sure everything is okay. Looks like we did get a scan of your brain here. Do you look awfully tired? So we're going to perform tests to figure out why you're so sleepy or why you can't fall asleep correctly at night. Is that the symptom that you're here for today? Great. And what we're going to do today for this full body medical exam is we're going to give you different medical professionals who will perform different tasks to cover your body and your brain and your health fully, including a full cranial nerve exam, a full eye exam to make sure all your eyes are perfect, those beautiful 2 ones, and a full secondary nerves exam before we let you sleep here in the sleep clinic, okay? Gorgeous. And before we do begin, a couple of questions here. How tired are you on a scale of 1 to 10? 10 being extremely tired and 1 being totally okay. Okay, thank you. And how are you feeling today? A little bit of this. We'll take care of you. Don't worry. Let's start. And I'll be the first one to begin. Just to check you in and get your vitals, etc. Okay. We're gonna keep our voices low to a low talk and or whisper. Is that okay with you? Okay. First gonna begin with just taking a look at you. Because we always start at the head. Right there. We just want to figure out if there's anything that we should figure with your brain, your eyes, and all of your cranial nerves, okay? So, first, we're going to begin right at the head for the head to toe exam. And check some vitals, okay? Any pain or pressure when I touch your scalp? I'm just going to carefully squeeze your head like that. Let me know how that feels. Once more. Okay. Any pain or pressure? Okay. I'm gonna get your blood pressure and oxygen level. Can I get one finger? Okay, you have beautiful nails, so I'm gonna clip this sideways. I'm gonna clip. Let's count for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And let's see. 98% pulse oxygen level and resting heart rate of 98. Are you a little nervous? It's okay to relax. Okay, I'm going to keep one perpetually on your finger throughout this entire exam as well to calculate your sleep during the morning time. So, give me one finger. We're going to place that on, and it's just going to calculate the same information throughout the duration of your visit. Is that cozy? Good. Okay. Next, I'm going to get your temperature with a thermometer. I'm just going to place it on your forehead twice. Relax. And you'll hear a click. Good. 98.8 degrees, and that's Fahrenheit. Once more. And 98.8 degrees. God, are you feeling too cold or too hot right now? Let me know if that changes. Okay. And we're just gonna do a super quick test with your eyes. A more detailed eye exam will be later. Can you look at that right there? Okay. Okay, and then look at the light. Now look at me. Good. Look at the light. Look at me. Good. Other eye. Look at the light. Look at me. Good. Look at the light. And look at me. Good. A little up close, we're going to check for something called nystagmus. Can you look at the light? Okay, look at my glasses. Once more, look at the light. Now look back at my glasses. Good, other eye. Look at the light. Look at my glasses. Look at the light. And look at my glasses. No signs of nystagmus. Looks like your pupils are properly dilating. Okay. We're gonna get gloves on now for the rest of the exam. Okay. Still continue with vitals. Let's get your heart rate with a stethoscope, okay? You're doing good. I know you're really tired. Your eyes are super red. Before I look at your heart rate, can I put a little bit of pressure on your eyes? You're gonna just feel a little touch. Look at my forehead. Little touch. Look at my forehead. Just a gentle pressure. Any pain? No pain? Good. Look at my chin, opposite direction. Just look at my chin. Good. Look at my chin. Any pressure around your eyes when I touch around your eyes? Okay. No pain, no pressure. Your eyes are just really tired though, okay? Okay. We're going to get your heart rate now. It's going to be a little cold. Just bear with me here. Okay, relax. And right here, breathe in, breathe out. Good. Good. Other side. Feeling okay? Good. I'm going to listen to your stomach now. Have you eaten today? It's okay if you haven't. Okay. Let me know if you need anything to eat. Right in the stomach. Relax. Good. And there. Good. And here. There. I'm gonna listen to your lungs now. Do you have asthma or anything like that? And have you been cold or had any cold-like symptoms within the past 2 weeks? Everyone's been getting a little sick recently. Okay, that can easily disrupt your sleep. No worries. I'm gonna ask you just to breathe in and breathe out, okay? Let's listen to your lungs. Put a place this on your back. It's gonna be cold. I'm so sorry. Good. And breathe in. Breathe out. Good. Here, breathe in. Good. Breathe out. Breathe in. Good. Breathe out. Here, breathe in. Good. Breathe out. Once more. Here, breathe in. Deep breath. Good. Hold. Breathe out. Your lungs sound great. Okay. Let's continue with the head to toe exam again. We're going to give you different people to perform different exams. That will also take longer to fulfill the full body exam, including a very detailed eye exam, a very detailed cranial nerve, etc. Okay? Good. I'm so glad you understand. So, let's just do a thorough head-to-toe test now. That's going to take a bit of time, okay? I'm going to start up at your scalp. And we're just going to put some pressure on your scalp and also check for lice, okay? Of course, we can have a more thorough exam later, but we're just going to quickly check your scalp for any type of dermatitis and just check your scalp for any health concerns, okay? All the way from the top of your head, let's just search. Behind the ear. And we found no dermatitis. I'm just going to touch through your scalp, okay? Just like so. Right behind your scalp like so. Okay, looks like your scalp is healthy. That's great. Good news. Okay, really quickly just touch behind your ears. Do you wear hearing aids or any hearing apparatuses that I should know about? Okay. So, behind the ears, A-okay. Do you wear glasses or contacts at all? Okay. And I need to get that one more time. Do you wear any hearing apparatus like a hearing aid? And or are you hearing partial? Do you need a hearing aid? Do you need glasses, etc.? It is okay if you do. Join the club. We welcome you. Okay, we're gonna quickly test your ears, starting from the top of the head. Then we're gonna go work our way to the eyes, nose, and then the rest of the full body. Okay. Quick test with your ears. Can you hear this? What about this? Any pain or pressure when I cup your ears like this? Any pain? One more time. You okay? Good. Left ear or right ear? Left ear or right ear? Left ear or right ear? And left ear or right ear? Good. Good. Quick test on your eyes. Look at me. We're going to drop some of the lights in the room. There you go. There. Okay. Look at me. Is that bright? Covering an eye. Do you see that? Good. And when do you see the light? Remove from your eye. Now. And here. Let me know when you can no longer see the light. Good. Here. Good. Here. Other eye, let me know when you can no longer see the light. Covering one eye up. Okay, can you see the light? Good, let me know when you can no longer see it. Good. 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 Great. Okay. Any pain or discomfort when I quickly checked your eyes? Okay, let me know if that changes. Okay. Good. We're going to do a quick test here with your eyes. I'm going to take a couple of photos with this optometry tool. You're going to hear 5 clicks. Can you look at the light? Right there. Okay, look at the light. Good. Other eye. Look at the light. Good job. Okay, right there. 5 clicks. Okay, right there. Okay. And don't look at the light. Look at my hand. Okay, corneas look good. Look up. Upper eye looks good. Look down. And lower eye looks good. Okay. Other side. First, look at the light. Okay, look at my hand. Good, look up. Okay, great, upper eye looks good. And look down. Good, okay. Look right back to the center. Okay, great. I look spectacular. Your eyes are gorgeous. They just look super tired, I'm going to be honest with you. I'm going to give you some eye drops, okay? So we're just going to give you some quick eye drops. These are to help you sleep and to relax your eyes. Okay? Look up. 5 drops on each eye. Just gonna go start off at 1. Blink. 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 Good. this side. Look up. Right there. Good. Good. And blink, 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 and blink. Good. They should feel a bit more tired now. Is that good? I'm so glad you understand. Okay, great. Writing that down. Now we added that for the next medical professional to know what I have added to help you sleep. Okay. Okay. We're gonna work our way down now. So we've covered head, ears, eyes. Let's test your nose. Let's look at your sinuses as well. Breathe in with your nose and out. Here, breathe in and out. Good. Let's look at the sinuses. A bit of pressure. Just a little tap. Good. And here. On the tops of your foreheads, you have sinuses here, and you have sinuses here, and they go all the way behind your ears. On the forehead, any pain? What about here? No pressure? Good, I'm gonna have you say ah now. Let's look at your beautiful shiny teeth. My shiny teeth and me. My shiny teeth that sparkle just like the stars in space. My shiny teeth that twinkle and add glimmer to my face. Look at those gorgeous teeth. Okay. Any pain with any of your teeth that I need to know about? Okay. And look below, say ah. Okay, good. And let's work all the way down. Let's first test your lymph nodes. Relax. I'm going to put my hands right here. I'll tell you what to do. I need pain or pressure. None. What about here? None. And what about here? Okay, I'm going to put my hands right there. Could you just pretend like you're swallowing water? Good, just try. Good, relax. Now a bit of pressure on the shoulders. Any pain? Give me your arms. We're also going to be looking for any signs of bruising, etc. Flipping your arm over. Here. Flipping it over. Okay, hands please. And flip it over. Hand. Flip it over. Let's look at your nails. Gorgeous nails, by the way. What is that polish color called? It's beautiful. Other hand. You do have calluses, which is good. Okay. Bit of pressure on your abdominal. Relax. Pain. Or sensitivity. You're good. What about here? Nothing? Good. Okay, let's check your beautiful legs. I'm gonna ask you to bend the knee. Good. Other side. Okay. And can you move your feet around at all? Just so that you can. Great. Okay. Let's write that all down for the next medical professional who comes by knows that you are stunning. Okay, so let me tell you what we're going to do now. As we're going to do a thorough full body exam. We're going to move on to, I think it's going to be in order, a full cranial nerve, a full eye exam, and then we're going to finish off with another nurse who will give you the rundown right before you do a sleep study with us, okay? That way we give you the full body medical exam, including all other resources to provide you the best medical results to figure out why you're not sleeping or to aid you in sleep, okay? Thank you for coming on by. I'm going to finish writing some notes up before we take you to the next room, okay? I'm so happy that you're here with us today. And get ready for optimal sleep because we have some of the best medical professionals here to help you relax and check your health fully. Have a good night. Good night. Okay. It looks like we have a detailed cranial nerve exam for today. The patient should be arriving sometime soon. Good. An hour long as well for the exam. I'll double check with them. Let's have the nurse send them in. Okay. Oh. Hello there. Are you here for the cranial nerve exam? Good. And to double check, have you been seen by a nurse already? Good. You've been with a nurse prior. That's good. Please make yourself comfortable, and if you could, I'm going to get a little bit close here. Could you please take a seat right at the chair that's in front of me? Yes, and you can also relax as well. No need to be stressed. This is a very relaxing exam. And welcome to Dream City Clinic. I am Dr. Cece. I will be performing your cranial nerve exam today. Is that okay with you? Okay. Are you okay with me being your primary care provider today? Good. How are you feeling, by the way? You just look a little bit tired. That's okay. Please rest your eyes. No need to be stressed during this medical exam, okay? Pinky promise. Pinky promise. Good. And a couple of questions before we begin, okay? How have you been feeling these past 2 weeks? Okay. It's okay to be honest as well. All answers are only recorded between me and this computer, that's it. And could I double check with your first and last name with spelling? It's a beautiful name. And your birthday? Beautiful. The Does that make you a Sagittarius? Maybe a Capricorn? Okay. So, have you been sick within the past 2 weeks, or how are you feeling? Maybe any sense of vertigo, fatigue, etc.? Okay, and how's your sleep been? Okay, so on my report here, it says that you have fallen asleep and you may have bumped your head somewhere, causing your sleep to not be as good. So we always double check with a nurse exam, then a cranial nerve exam when that happens. And trust me, it happens all the time. I actually was watching Netflix and I fell asleep and I rolled off of my bed and got myself my own cranial nerve exam. So very common and normal, okay? And shall we begin? Good. So, my hands are clean. I'm just gonna first touch your face if that's okay with you. Good. I'm gonna get a bit up close. What the cranial nerve exam does, by the way, is we're gonna be checking all 12 of your cranial nerve sensations around your face. The first test I do is for your sensory nerve, which is just sensation around the face. Okay? And I'm just gonna put my hands on your face. You let me know if you feel it by saying yes or no when I ask, okay? Good. So, yes or no? Good. Yes or no? Good. Yes or no? Good. Yes or no? Good. Yes or no, right there. Is that spot a little bit uncomfortable? Is that where you may have bumped your head or just fallen asleep strange? Yeah, I can see. But can you feel that? Okay, any pain? Okay. Yes or no? Okay. A little bit below. Yes or no, right there? Okay. Right there once more, yes or no? Okay. And right there, yes or no? Okay. Good. And no sensations of pain when I touched your face at all? Okay. And were there any spots on your face that you could not feel? Okay. I'm just gonna carefully now analyze your eyes if that's okay with you. I'm gonna get some gloves on first though, don't worry. And how have your eyes been? Have you been feeling like there's any sense of change in your vision recently? Okay. Just tiredness. Okay. So, your eyes have several cranial nerves connected to them. They're very important. I will be testing these several sets of cranial nerves for your eyes to make sure everything is going well. Okay. Good. So, I'm just going to carefully ask you a couple of questions. I'm going to get up very close to your eyes. I'm going to put some pressure on them. Close your eyes for me, okay? Good. Close your eyes and do you feel that? Good. Keep your eyes closed. I'm going to put pressure underneath. Do you feel that? Good. Do you feel that on specifically the one eye? Which, left or right? Good. Left or right? Good. Okay, left or right? Good. Left or right? Good. I'm gonna get very much so up close now. I'm gonna ask you, can you open your eyes for me? We're gonna do something called a blink assessment. I'm going to ask you to blink for me. This may make you very tired. It happens to a lot of people, okay? It's totally normal that you get very sleepy during this part. But I'm going to ask you to blink at random intervals. I just I'll even give you a dialogue with my hands of when to open and close your eyes. Good. Okay. So, look at me, please. Good. Blink. Good. Blink. Good. Blink. Good. Blink. Great. And blink. 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 Good. Blink. 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 Good. Blink. 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 Good. And blink. Good job. Now, did you feel any sense of vertigo when I asked you to blink? And a quick update, vertigo is a feeling of imbalance. Specifically, you'll feel it in your head. If you've ever felt vertigo, sometimes you can actually get it from sleeping strange. Yes, so it kind of feels like your equilibrium is off. Any senses of feeling like you're a bit unbalanced at all, yes or no? Okay, that's okay if you do. If you'd like to, we can have you lay down as well. All you have to do is just lay down. I'll continue the exam, okay? Good. Are you feeling okay so far? You're doing good. Good job. Okay, we are going to move on now to the eye light exam. Do you have any sensitivity to light? Because if you can do, you could close your eyes and still participate. Okay, just keep your eyes open then, or close them if it feels like the light is too much. All I'm going to ask you to do simply is let me know when you see the light. Just say yes or no. Okay, I'm gonna just carefully put my hand next to your eye as well, okay? So, just say yes or no when. When. Good. 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 Do you see it? Good. No. Good. No. Good. No. Good. What about now? Good. And now? Good. So, question time once more. I'll ask you a lot of these. Do you feel like the light was too much, too bright, just fine? And do you feel like you're seeing several sets of light or double vision at all currently because of that? And then can I continue using the light? Good. Okay, once more. I'm going to get a little bit more up close now. I'm going to be taking a look deep inside of your eyes, okay? Good. So, I'm just going to get a bit up close. Might just be talking to myself a little bit, but what I want you to do is look at my nose. I'll direct you to look everywhere else once I ask you to, okay? For now, look at my nose. I'm just going to take a quick look with your eyes right there. Looking a little bit above like that. Okay, looking at this light above right there. Okay, take a look at your eye, okay? I'm going to carefully just think this. Okay, let's go. Okay. I'm going to keep a little bit up close. Can you look at the wall right there for me? Good. So looking at the bottom of the your pupils back and forth as a way to balance your equilibrium. Sometimes if you sleep strange or you don't sleep well enough and you do experience some sort of vertigo or perhaps some sort of pressure on the head, aka that could mean anything. Nystagmus is something that your eyes do when they shift to fix with your equilibrium, and or if you have pressures somewhere along the head and the neck. Okay, what I want you to do is just look right at my eyes, and I'm going to shine the light in random intervals. Just keep looking at my eyes, okay? Again, I'll be talking to myself, just looking for things, so just look at my eyes. Good. A little bit, just going to take a line like that. So, experiencing what appears to be self-centered fatigue. So I'm just going to take a quick look, okay? A little bit of pump. We're just going to take a quick look. Just going to see up there when I'm going to look at the eyes, okay? A little bit of fatigue-centered focus. So I'm going to just see like that. I'm going to pull it like that, okay? Just going to put a little bit. I'm going to put a little bit like that, okay? Okay, very good. I'm going to move your chair back a little bit now. It's okay with you? Are you still feeling cozy and comfortable? Good. I did not see any nystagmus. Amazing. So, we're going to be testing your eyes with reading and numbers now, and a bit of color. Okay? You're going to see this chart behind me, and this is called the Snellen's chart. I'm going to be pointing at some numbers and some letters, and I just want you to read them with the best of your ability. I'm also going to cover your eyes at some points and ask you about the same letter to see if you can see it, or if there's difficulty with one and not the other. Let's begin. So, these are my eye chart tools. I will point with this, and I'll cover one of your eyes with this. Let's first begin. What letter is that right there at the very top of the chart? Yes, that is E. Good job. Okay, we're going to go down to line 2. Can you see anything on line 2 right there? Okay. What letter is this one right there? What letter is that? Good, that is F. Good. What letter is this one next to it? That is the letter P. Very good. I'm going to cover one of your eyes now, okay? Just covering one of your eyes up. And quick, asking you here, what letter is the top one there? That is E. Good. Covering that up again. What letter is that right there? F. Very good. And can you still see this letter right there? That is P. Good. I'm gonna cover up another side of your eye now, okay? So, can you still see the chart now? Yes or no? No. Good. Moving down. Are you still able to see the third line? Yes or no? Good. What letter is that right there? That is the letter O. Good. Going back up, what letter is the top one? E. Good. Going back down to the third line. What's this final letter right there? What letter is that? That is Z or Z. Very good. I'm going to cover your eye one any difference with the vision? What letter is that? Okay, that's still C. Good. What letter is this over there? That's still T. Very good. And covering most of your eye now. Can you still see the top letter, yes or no? Okay, barely. Okay, good. Let's use the numbers on the sides now. What letter is this top one right there? That is 1. Good. What letter is this one right there? 2. And this right there? 3. Do you notice that the letters are changing in size as the numbers are? Or do you think the numbers are staying the same while the letters are getting smaller in size as the numbers go down? Good. So, if we can see here, the numbers stay the same, but the letters decrease in size. Very good. I'm going to move on to more difficult ones now, down below. Are you able to read below the red line at all? Okay. I'm going to ask you on line 9, right there, line 9. Can you read this letter right there? What letter is that right there? Maybe a bit difficult. It is most difficult for most people. Okay. Are you seeing any doubling of letters next to each other at all? Or are you seeing any sense of difference in your vision the smaller the letters go? Okay. And what letter is that? Good, that is a T. Yes, it's very difficult. Okay. At the very end there, what letter is that? Again, very difficult to see, but what letter is that if you try your best? That is the letter L. Yes, I see your eyes are getting very tired. I'm going to cover your eyes once more with the tool. Can you still see this letter at the very last? Good. Any differences with your vision or distortions? Okay. And what about what letter that is right there? Can you see that at all? What letter is that? That is right there. That is O. It could easily be described as a D as well. What letter is that next to it? Good. That looks a little bit like O and D again. Very good. This one's actually a D. Do you remember what letter that is? Is there any distortions when I show you the first one of letter 9? Okay, that is the letter T. Still very good. And quick question. Again, once more, any distortion with your vision when I cover your eye at all? Okay. And I do see that you have very fatigued eyes. Are your eyes getting very tired? Okay. Good. So, I am going to do a memory test with you now. And we're going to ask you just to simply perform a quick eye exam. I am going to close your eyes, but I'm going to ask you just to remember the top letter here, E, for me, okay? But I'm going to ask you carefully to just close your eyes for 10 seconds, okay? And close your eyes. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay? And quick questionnaire. Do your eyes feel a bit more tired now that I asked you to close them for 10 seconds? Okay. And quick set of questions. Do you know what color my chair is behind me? Pink. Okay. What color are my glasses? Like a pink red. And what color is my glove? A blue. Good. What did I tell you to remember? Okay, was the letter? What letter was the letter I told you to remember from the chart that was there? It was the letter E. Very good. Good job. So sometimes the reason that we test cranial nerves is for some sort of concussion or some sort of pressure applied to your head or some sort of vertigo. It is very often that a symptom of having some sort of concussion frequently is having the inability to remember something in a very short period of time. As a professional, I always make sure that I hit every single cranial nerve to make sure that you're okay. Okay? Good. Okay. Next eye exam here. We're going to be working on the vestibular cranial nerves, which happens to be next to your ears and is also connected to your eyes, okay? What I'm going to be testing first is sense of sound with the reaction to your eyes. So I'm going to be using my pen light once more, and I'm going to click the pen light and flash the pen light onto your eyes. You let me know how many times you see the light and you hear the click. Are you ready? First, I want you to count how many times you hear me click the pen. Let's begin. I'm going to shine this on your eyes, okay? Not too bright, though. Let's start. Count how many times I click the pen. Let's begin. And how many times was that? Okay, that was... I clicked the pen 20 times. Very good. Okay, once more. This time, I want you to count how many times you see the light flash in front of your face. It won't be too bright, trust me. Let's begin. And how many times did you see the light flash? Okay, it was between the number 5 and between the number 7. Good, it was the number 6. Very good. How many times do you think it takes for me to click the pen for the light to flash 6 times? Very difficult question indeed. The answer is 6 times 2. Do you know what 6 times 2 is? Very good. So that means the pen clicked how many times? Good. 12. Good job. Basic mathematics test. I'm going to lift my fingers up and you let me know how many numbers you see. We'll begin the addition part with raising 2 hands up after the first test. Let's begin. How many fingers am I holding up? 1. Good. How many fingers am I holding up? 2. Good. How many fingers? 3. those are my eyes. But we're gonna test your peripheral vision around your eyes, okay? So, let me know when you can no longer see my hands in your peripheral vision, okay? So when the blue gloves disappear, let's start. Let me know when. Good. Let me know when. Good. Let me know when. And let me know when. And let me know when. Okay. Now let me know when once more. Good. Now, reverse. Let me know when you see my hands come into your visual field. So when you see them, let's begin. Good. 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 And now, let me know which hand is closer, left or right. Let's begin. Okay. Left or right. Good. 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 And left or right. Good. Good job. You did amazing. So, your peripheral and distance vision test are perfect. And it also looks like we have a lot of statistics about your information for your eyes. Now, a quick question. Are your eyes getting a bit dry? Let me quickly add an eye drop into your eye, okay? So, I'm going to carefully add this eye drop into your eye. This is going to relax your eyes a lot. It also smells quite good. If you smell that, it smells very similar to if you've ever had like a lavender tea. It smells exactly like that, but it's really good for your eyes. Look up for me, please. Do one drop there, and the other drop there. Good. And then blink, 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 blink. Good. Now, I am going to test your sense of smell. We'll go back to your eyes once we test your vertigo, okay? So, we're going to be testing your nose and your olfactory sensory nerves, which is your sense of smell and your sense of taste. Have you had any difficulty since you've been having difficulty sleeping with your sense of taste and your sense of smell at all? Okay. Have you been enjoying food as you used to? You deserve to enjoy good food. Okay. So, I have an array of essential oils here. I will ask that for this part of the exam you please close your eyes, because it will be very easy to tell what the essential oil is, because let the medicine sit in your eyes. Good. I know your eyes have been tired. So close your eyes, please. Thank you. Good. We're gonna start off with this essential oil right there. This one is one of my favorites, okay? So, go. Smell that. And what essential oil do you think that is under your nose? Very aromatic. Smells like a fruit. Very good. Smells like citrus. Good. That is orange. Fantastic. Good job. Good, good, good. And there are also no right or wrong answers, by the way. Good. This next one I think is easier, but I just need a general idea of what you think this could be, okay? So, we have this one right there. It is right under your nose. Now, please breathe that in. And what are you sensing from that? Good, that's floral. That's perfect. That already answers my question. Any guess as to what type of floral? Okay, good. This one is actually jasmine. I think this one is one of the most soothing scents. The only answer we needed from this was floral and sweet. Good job. On to the next one now. Fan favorite for this essential oil. Again, don't take a look. Otherwise it will be obvious. I'm gonna put this right under your nose, okay? And do you know what essential oil that is? You got that one very fast. This one is a peppermint, a mint, and it also reminds you of candy. Yes, this one is eucalyptus, and everybody uses eucalyptus very frequently for candy. It's amazing also for spa treatments, and I really recommend this. You can probably get eucalyptus in a spray that you can apply before bedtime. I find that eucalyptus helps you relax and sleep, but it also opens up your nose. You got this right away. Good job. Okay. Are you ready for the next one, or do you need a bit of a scent break? You're good to go. Okay. Keep your eyes closed, please. This one is fantastic. Okay. I'm putting this one underneath your nose now. Any idea what this one could be? Good. Floral. That's great. What else? Any guess? Okay, a bit like an herbal tea. That's perfect. Any guesses? Very good. If you got lavender from that, or thought about it, that is correct. Again, the answer we were looking for was floral, sweet, and also medicinal, because it does have the lavender unique smell that is very often used in spa treatments, and is also very often used for relaxation and sleep. Good. We are going to move on to the two most difficult essential oils now. Again, there is no correct answer. Just take a guess at what you think. If your guess is as good as "I'm not sure," that is also allowed. We just want you to take a guess. You ready? Let's go. So, keep your eyes closed. This one is one of my favorite. Okay. We have this one right here. What do you think that one could be? As I said, this one is pretty difficult. This one smells like a fireplace. That's perfect. So what do you think that could be? Perfect, like a tree. Good. This one is sandalwood. You did amazing. It smells like a fireplace by the beach. Amazing. I love this one for sleep as well. And the last one. It may be easy for you to identify, but for a lot of people, this is the most difficult. Are you ready? Let's go. Keep your eyes closed. But what do you think this one smells like? Okay. You got right away that it is like a tea. Very good. It is often used in teas. Okay. Any idea? Okay. A little bit difficult. You can open your eyes now. Good. This last one is chamomile or chamomile. This one is the most difficult for people to get. Either they get it right away or you can't even take a guess. You did amazing by guessing tea. Good job. Now, do you feel okay after smelling all of those essential oils? Do you have a headache at all? Or do you feel some sort of fatigue coming on? Let me know if that happens, okay? And we'll switch the exam. I'm writing your results down now. And next up on our list, we're going to be testing your sense of taste. And again, has your sense of taste been good recently? Okay. So, I'll show you what we have to work with, okay? So, I have these two liquids here. And each of these vials contains a different tasting solution. I'm gonna let you know now. One of these tastes like nothing at all. It's just water. And the other one tastes exactly like strawberries. You let me know which one is which. Again, you can't tell from the vials, but let's take a guess. Are you ready to begin? Good. Which one do you want to start with? The brown one or the green one? Okay, we're going to start with the green one. I'm going to ask that you say ah. Okay. Say ah. 3, 2, 1. Good. And then just let the flavor. Yes. That one was water. Very good. This one always gets people because it's in a green vial. Now, this one could also be water or it could be strawberry. Are you ready? Let's begin. Okay, say ah. going to be testing your sense of hearing, and also this relates to your sense of vertigo. Would you like me to do the vertigo test first, or would you like me to do the hearing test first? Okay, we'll do the hearing test first. I'm going to get very up close for this. Okay, so how we do the hearing test is I have these hearing tools that make a sound. You let me know if you can hear it. That's it. I'll show you. These are called tuning forks. Now, you can't eat with them, but they have a very strange and or interesting sound. You typically use them to tune an instrument. Now, what I do is I tap the instrument on my hand, and it's going to make a sound. All you need to do is let me know if you can hear it. Are you ready? Let's start. Once more. Could you hear that? Okay. Next one. Are you ready? Let me know if you can hear it. Okay. Could you hear that? Yes or no? Once more. Yes or no? Okay. Okay. Yes or no? Okay. And could you hear the third one? Yes or no? I'll do this one once more. Yes or no? Good. Only two more now. Let me know if you can hear it. Are you ready? Let's begin. Yes or no? Once more. Okay. And one more now. Again, if you can't hear anything at all, that's absolutely okay. Let's begin. Could you hear that? Once more. Okay. Thank you very much. So, the last two are typically the most difficult to hear. Did you find difficulty with this too? That's okay. Okay. Now is the sound test. I am going to whisper a word into your ear, and I want you to repeat the word back to me if that's okay with you. Good. I'm going to get on one side. I'm going to whisper a word. You repeat it back to me, okay? Pomegranate. 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 And what word was that? Pomegranate. Very good. Good. Other side. Flip, flop. Flip, flop. Flip, flop. What was that? Flip, flop. Very good. And that was sleep. Very good. Okay, now we have to do your left or right test. Okay, what that is you let me know if the sound is coming from your left side or your right side. I will not correct you at all for this, just based off of what you can hear left or right side. I will be moving my hands away from your visual field. You can keep your eyes open though, but you let me know if I'm making a sound from the left or the right side. Do you have any hearing partialness? Perhaps one ear hears better, or you have one ear that is deaf. Okay, I do too actually, so that's okay. But let me know, do you? Okay, try your best. Are you ready? Let's begin. I'll first be using my gloves. Okay, let me know, left or right. Good. 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 Now, I have these little sprinkles. They make a very good sound. They sound like a maraca. You let me know if you're at left or right. Let's begin. Good. 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 And left to right. Very good. Good job. Okay. Now I'm going to do the vertigo assessment. You let me know at any point if it bothers you, but we're going to be testing your eyes and we're going to be moving your head. Are you ready? Let's begin. So I'm just going to move your head a little bit, okay? Just going to carefully just move your head a bit. I know it might be a little silly, but keep your head this direction, okay? Now let me know, when do you see my pen light across the screen of your eyes? Do you see the pen light at all? Good. And when is it the brightest? Is it brightest here or here? Good. Is it brightest here or here? Is it brightest here or here? Good. And is it brightest here or here? Good. Can you see my hand moving? Can you see my hand moving? And do you see one finger or two? Good. One finger or two. Good. I'm going to tilt your head back and then the other direction, okay? And keep it this way, okay? Good job. Now, let me know, do you see the pen light now? Good. And what about now? What about now? And what about now? Let me know, when is the pen light brightest? Is it brightest there or there? Good. One or two. Good. One or two. Good. One or two. Good. And then one or two. Okay, the same. How many fingers am I holding up? Two. Good. How about now? Good. How about now? Good. And how about now? Two. Good. I'm going to turn your head back to normal, but I'm actually going to turn it a little direction this way. Do you still see me? Good. Do you see my wall? Good. Do you see me? Good. Do you see my glove right there? Good. And do you see me? Good. And back to center. I'm going to tilt your head a little lower now. Okay. Can you see right there? Can you see above? Can you see in the center? What about below again? And above? And the center? Good. Do you feel any sense of double vision currently as I moved your head left to right, side to side, and up to down? Okay, and let's move your head all the way back up now. How do you feel? Good. Okay. And then lowering your head once more. How do you feel? Good. Good. Okay. Now I'm going to remove this one glove. We are going to be performing our final exams. This is called the sensory part of the exam, but this time it will be physical. I'm going to first do a hot and cold part of the test. What that is this part of the metal is very cold. Okay, my hand is very warm. I'm gonna ask you just to close your eyes, okay? Close your eyes like this. And you let me know if I'm placing the cool metal on your face or my warm hand. I'll do it all around the sides of your face and a little bit on your neck. Is that okay? Let's begin. Okay. So, warm or cool? Cool. Good. And warm or cool? Warm. Warm or cool? Warm. Warm or cool? Warm. Warm or cool? Cool. Warm or cool? Cool. Warm or cool? Warm. Warm or cool? Cool. Cool. Warm or cool? Cool. And warm or cool? Very good. Warm. Okay, so we're gonna write that off as the final. You've got a very good sense of that. Now, I'm gonna ask you to just do some silly things for me. We're gonna do a sharp or soft test now. So, I have this little tool here. It has a soft part and a sharp part. You let me know what's touching you, the soft part or the sharp part. I'll show you soft first. This is soft. And this is sharp. Are you ready? Let's begin. Keep your eyes closed for this too. Soft or sharp? Good. Soft. Soft or sharp? Soft. Soft or sharp? Sharp. Soft or sharp? Sharp. Soft or sharp? Sharp. Soft or sharp? Soft. Soft or sharp? Soft. And then soft or sharp? Sharp. Soft or sharp? Soft. And soft or sharp? Sharp. Very good. hands here next to your lymph nodes. I'm going to ask you just to swallow for me if possible. Good. 3, 2, 1, and swallow. Good. Any difficulties doing that? Okay. I'm going to put my hands next to your ears. Any pain? Good. Okay. And then a quick test of your reflexes here. I'm just going to put my fingers before I tap, but you let me know if you feel it. And I'm also going to be looking for a flinch. Are you ready? Good. Feeling good. Good. Good below the nose. Good on the jaw. Good on the shoulder. Over there. Give me your arm. Good, other arm. Good, and back on the forehead. Good, and then once more below the nose. Okay. So, it looks like your cranial nerve exam is complete. Thank you so much for coming here today for the exam. I'm going to be finishing off by writing some notes, but I want you to sit and relax, and then I'll excuse you in a couple of minutes once I'm done taking notes, okay? Thank you so much for performing and being in the exam today. I will give you your results right when you're done, but you're spending over the night here at the clinic, correct? Good. I'll have a nurse get you in about 5 minutes, but you can relax and close your eyes. I'll dim the lights a little bit, but I'm just going to be taking some notes, okay? Okay. Your results are fabulous, don't worry, but I want to complete them and then I'll let you know afterwards. Cheers, darling. Thank you so much for staying here for the extremely detailed cranial nerve exam, over an hour. So thanks for your participation and patience. Yes, thank you so much. Cheers. I'll write my notes now. sleep, lack of deep sleep, and it says here you may need a new prescription. Is that correct? Okay. Do you currently wear any glasses or contacts? Okay. And would you say that you are more of someone who is nearsighted or farsighted? Okay, thank you. If you have no idea, that is okay as well. And last question before we begin. Are you allergic to any eye drops or medicine that I should know of before continuing? Okay. Thank you so much. So, we're going to do a really classic eye exam today, and we're just going to check all parts of your eye, especially because you said that you are extremely tired and perhaps your sleep wasn't the best. Okay. First, is it okay if I just do a pressure test, and we're just going to check your vitals for your eyes and your face, okay? Good. First, going to put my hands right next to your eyes just to touch them. Let me know if you can feel that, okay? Let's start right there. And could you feel that? And here. Could you feel that? Okay, and look right there at the center. Look at me. Good, and can you feel that right there? Okay, what about right here? Okay, good. Was there any pain when I touched around your eyes? Okay, I'm gonna do something a little bright. Do you have any sensitivity to light or flashlights at all? If you do, you can close your eyes for this next part. Okay. I have a pen light here, and what I'm gonna do is just look right into your pupils. I'll let you know where to look, okay? Look at that poster right behind me first. And we're just gonna take a quick look. Don't look at the light. Don't look at the light. Good. And good. It looks like your eyes properly dilated when I put the light over your eyes. Was it a bit too bright? Okay. Other eye now. Just super quick, because we're going to do a detailed part very soon. Okay, can you look at that door right behind me? I'm just going to take a quick look again. You have beautiful eyes, my goodness. And don't look at the light. And good. I do see the redness and irritation from what appears to be lack of sleep, but we'll find out more about it. Let me go get the eye drops. We're going to put 2 types in your eyes. One of them is just going to make your pupils very large, and it's actually going to make you really sleepy. It's okay if you close your eyes. And the second set of drops is going to add a little layer of yellow over your eyes so that I can properly look at every part of your eye. Let me go get them. Okay, we have the drops. I'm first going to add the one that makes your eyes a little sleepy. Okay. And can you look all the way up for me? Good. I'm going to drop that right there, and I'll tell you when to blink. Okay. Blink, blink, blink. Other eye. Look up. And blink, blink, blink. This works almost immediately. You should feel that your eyes are getting very sleepy, and they also make your eyes feel slightly tingly, as if you've been super tired throughout the day and you can't wait to close your eyes. Okay, are you ready for the second set? This one is just 1 per eye. Good. Good. I did see that your eyes kind of fell asleep at that part. Could we try that one more time? Good. If you need to close your eyes though, please feel free to keep your eyes closed. Okay. Follow the light. Good. Follow the light. Follow the light. Follow the light. And good. Okay. Was that a bit more difficult? Okay. We're gonna now close the lights in this room to test your eye function. So let me go close those. Perfect. We're in a bit of a darker room now. Let's try this one more time. Okay. You probably can see the light more clearly now, is that correct? Good. Look at that light and follow it. Great. Better performance when we've closed all of the lights and the windows in the room. Good. Follow that light. Follow that light. And follow that light. Good. Now continue to follow the light, but don't get distracted by my hands, okay? I'm also now testing to see if your focus is something that we need to fix for your corrective lenses for your glasses. Just follow the light, don't get distracted by my hands. Good. 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 Keep looking at the light. Good. Good. Great. Good. And look at the light. Look at the light. And look at the light. Look at the light. And stop. Good job. Okay, that was a great focus test. I'm going to shine some lights now over your eyes. You have 3 colors to choose from. You have either red, green, or blue. Let me know what color you see, okay? Do you know if you have any color partialness with your vision? Unsure? That's okay. Let's find out. Red, green, or blue? Let's start. What is this color? What's that color? That is red, green, or blue. Let me know in 3, 2, and 1. That is red. Good. Red, green, or blue? Red, green, or blue? Red, green, or blue? And red, green, or blue? 3, 2, and 1. That is blue. Okay, that should leave the last one up to be super easy. Red, green, or blue? Let's start. Red, green, or blue? That is green. Good job. Okay. It looks like you passed the lights off exam where the room is dark. We're going to brighten the room again, and now we're going to give you something called the lens 1 or 2 test. Let's start. Okay. Now that the lights are back on, we're going to do something to prescription, we're going to give you something called the lens 1 or 2 test, where you let me know what lens you think is a better corrective lens for you. Lens 1 or 2. Okay. And then afterwards, we're going to give you a field of depth perception test with the Snellen's chart, which is this letter chart. Shall we begin? Good. I'm first going to put these glasses on you so that they're able to hold the lenses. So let me just apply that right here. Okay, and is that cozy when I just apply that? There. Okay, let me just adjust that a little bit. Okay, good. Are you ready to begin? All you need to do is let me know what lens looks better, 1 or 2. Let's begin. We're gonna first start with the concave sphere and then move to the convex sphere to make your perfect prescription. Okay, let's start. What looks better? Lens 1 or 2? Here is lens 1. 2. 1 and 2. What looks better? Lens 1 or 2? 1 or 2? Lens 1 looks better. Okay, that is -7 in comparison to -10. Good, let's keep going. Lens 1 or 2? Lens 1. Lens 2. 1 or 2? immediately. Okay. 2 is -6, and you chose that over -10. Okay. Let's try this again. Let me know what looks better, lens 1 or 2. Let's start. Lens 1, lens 2, 1, 2, 1, 2, 1, or 2. It looks better. 2 looks better. Okay, should I show you one more time as well? Here's lens 1 and 2. Okay, for sure, lens 2, you chose -5 over -6. That's great. Now we're gonna do a little bit of a lower prescription. I'm gonna do this one, and I'm gonna choose that prescription. Are you ready? Okay, well, it looks better. Lens 1, lens 2, 1, 2, 1, 2, 1, or 2. Go back to 1, and then there's 2, 1, and 2, 1. Okay, lens 1 is -3. Okay, and I think we're getting close to the smaller prescriptions now, which is where I thought you would be to begin with. Well, it looks better. Lens 1 or 2. Let's start. Lens 1, 2, 1, or 2. Go back to 1, 1. And what about 2? Okay, what does 1 look like? Blurry and a bit up close. What about 2? Balanced and not so much. So lens 1 or 2, what looks better to you? 2. Okay. Lens 2 is 1.25 or -1.25, which would be a shorter, smaller prescription. And let's test that with the better one that we have. Let's go. Okay. What looks better, lens 1 or 2? 1, 2, 1, or 2. It should be a little bit more difficult now. 1, 2, 1, or 2. No difference one more time. Lens 1 or 2. Okay, lens 1. Okay. Lens 1 is 1.25, which is your convex sphere for your glasses. Okay, we have found your perfect prescription to optimize your eyes. Okay. And we're gonna do one last test here, which is testing your eyes on the Snellen's chart. Is that okay with you? Good. So, I'm actually going to use this pointer, and I'm going to point out certain letters with you sitting 6 right there. Okay. Looking at line 6, are you able to determine what these letters are? Okay, so it's not too difficult so far. Okay. What is the second letter in line 6 that I'm pointing at right there? What is that? 3, 2, 1, D. Good job. And just to put it right at your eye level, what is that letter second from the last in line 6? 3, 2, 1, C or Z. Good job. Okay. Let's push it all the way down to the red line. Can you see those letters right above the red line? Okay. What is that letter right there? That's a D. Okay, what about the next? 3, 2, 1, E. Are the letters getting significantly smaller now in your field of vision? Okay. And what about that letter right there? 3, 2, 1. That's O. Good. And then what about that letter right there? That is 3, 2, 1. That is C. Very good. Okay. 2 lines left, and they're going to get more difficult, as I said before. We're going to go all the way to 10. And this is where it gets very difficult for most people. Are you able to read that first letter of line 10 for me? Try your best. 3, 2, 1, F. Okay, what about that letter right there? 3, 2, 1, T. Okay. And now the last letter of line 10. 3, 2, 1, O. Okay. Are you ready for the final line? I promise this is just going to tire your eyes out so I can take a look at them better. Good. Okay. Last line. It is okay if you don't get these, but it is absolutely wonderful if you did. Any idea what that letter is? Third letter of the line, the last line, line 11. 3, 2, 1. That is Z. Good job, C. You did fantastic. And let's push it all the way to this letter, second to last in line 10. 3, 2, 1. Try your best. What is it? It is T. Good job. Okay, so it seems that reading distance is not affected by your current vision, which is stunning. We love that. And it looks like we have updated your prescription to be absolutely fulfilled and perfect and on time. We're going to create a different set of prescriptions for you, and then afterwards you can go to our shop and get a different pair of frames when you are ready. Does that sound okay and fabulous for you? Okay. As well, I'm going to watch you for the next 25, 30-ish minutes to see how your eyes perform when we do slightly lower and dim the light. And what I'm going to do is I'm just going to sit here and type and examine you randomly. And we're going to just let your eyes rest after we've applied the eye drops so that you are ready to leave afterwards, okay? Good. So sit back and relax. You can close your eyes. I'm just going to examine and make sure that you're going to be good for just a little bit until we send you on home, okay? Thank you so much for coming on by to the Classic Eye Exam again. I am Dr. I here at Dream City Clinic. Pleasure to meet you. Just relax and sit on by. Thank you so much for coming on by for the eye exam. And again, before you leave, we're going to give you your printout paperwork of your updated prescriptions. What we found specifically with you, I did find that you might need to sleep more throughout the night, so I'm going to recommend an 8 to 9 hour sleep period, even if that is difficult. I also highly recommend naps, and I highly recommend ASMR videos to help you sleep, okay? So I'm going to sit here and take some notes. I will give you a printout, me or the concierge at the front will, and we will call you back on in when your first set of prescription lenses are set so that we can find you the perfect pair of glasses. Thanks for coming on by. Ciao. there. Pleasure to see you today. Are you here for the nurse exam? Eyes closed today? Good. Welcome to Dream City Medical Facility. I am Nurse Cece. Pleasure to meet you. Please take a seat, as this exam is very important for your sleep, and just relax on the medical chair. There's a button for you to lean back into, and we have pillows and blankets right to the right of you, okay? So, this is a very important exam that we have to cover today, and all you have to do, you must pinky promise, you will keep your eyes closed throughout the part of this entire exam, okay? First, we're going to apply some pins, little hair clips next to your eyes to make sure that you're keeping your eyes closed, and so that we can analyze when your eyes are open or closed, okay? Good. Let me add these little clips. May I just touch your face a little bit and add them next to your hair? And it said that on your chart you may have some trouble falling asleep and keeping your eyes open, correct? That is no problem with me. We're going to be running just random medical exams on you and making sure your eyes are closed, okay? Like a cranial nerve exam, but a little bit more special. The doctor will give you the results afterwards. Okay, the clips are in, and we're going to ask you to close your eyes in 5 seconds. You must keep them closed. Are you ready? I'll first ask you to blink, and then you gotta keep your eyes closed for the rest of the exam, and I'll be watching and reminding you to keep those beautiful eyes closed. Close them. First blink, and then open them. Very good, and this is your last time taking a look. And now you must promise to keep your eyes closed. Close, 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 close your eyes. Good. I'm going to start out just by testing to make sure your eyes are closed by giving you a couple of light exams and sound exams, okay? I'm going to pull out my gloves first before I touch your face and get some gloves on. Now that your eyes are closed, I know you might feel the temptation and urge to open your eyes, but I'm analyzing you, okay? Let's start off with the eye exam with your eyes closed. I have a pen light. I'm going to flash in front of your eyes, and I'm going to ask you to see if you can see it over your eyelids. Keep your eyes closed and let me know if you see a pen light over your eyelids, okay? Do you think you can see that over your eyelids, yes or no? Maybe a little bit. Good, you're doing great. Keep your eyes closed. A little bit closer. Do you think you can see that pen light shining over your eyelids? Right there. Yes. Okay. Now let's try an even brighter light. Keep your eyes closed and let me know when you can see the pen light over your eyelids. There. Okay. There. Good. There. Good. There. There. Good. And then I'm actually going to turn off a couple of the lights next to you for this next part of the exam. Keeping your eyes closed now, what I'm going to do is just carefully ask you just to look carefully when you see the light over your eyelids. I want you to either raise a finger or say now. So keep your eyes closed. Try not to peek. Do not take a look. Do not pass go. Do not collect $200. Let me know when you see the light pass over your eyelids. Let's start. Good. going to shine the light over your eyelids, but let me know when you no longer can see the light over your eyelids, okay? Good. Keep your eyes closed. I saw one of your eyes flinch a little bit. Keep them closed. So, shining the light over your eyes, let me know when you can no longer see the light in your eyelids. Try not to look with your eyes open. Keep them closed. Right there. Perfect. Let's restart. Good job. Okay. Keep those eyes closed. We're going to restart. The light is on your eyelids now. Let me know when you can no longer see the light on your eyelids. Good, right there. Restart one more time. I know you're trying to fight the urge to open your eyes. Keep them closed. And the light's on your eyelid now. And let's see. Let me know when you can no longer see the light over your eyelids. Great, right there. Good. Okay, we're going to switch the next visual light exam. And I have 3 lights in front of me. One of them is red, one of them is green, and one of them is blue. I want you to keep your eyes closed, okay? And let me know which color you think the light is going over your eyelids. Is it red, green, or blue? Please try not to open your eyes because it will be very obvious, of course. So, keeping your eyes closed, what light is over your eyelids now? The light is just carefully passing over your eyelids. Any idea if this one is green, red, or blue? Take a guess in 3, 2, and 1. Did you guess blue? Very good. Keep your eyes closed. Good job. Let's shuffle them up. You might get the same color more than twice. So green, red, or blue. I'm gonna put the next light over your eyelids. Keep your eyes closed. Try not to take a look. And this light is over your eyelid. Now, is this one green, red, or blue? Keep your eyes closed and green, red, or blue. Take a guess in 3, 2, 1. Very good. You got green, correct. Good. Let's shuffle the lights up randomly and see what we get next. Green, red, or blue. Let's start. What color is this light? Keep your eyes closed. And what's this light over your eyelids? Green, red, or blue? Good. Keep your eyes closed. I saw you open them a little bit. Green, red, or blue? Take a guess in 3, 2, and 1. Very good. That was green. Okay, let's see what we have here. Green, red, or blue? Last light. Keep your eyelids closed. Very good. And what color is this light passing over your eyelids? Green, red, or blue? Good. Take a guess in 3, 2, and 1. Very good. It was red. your eyes for this. Don't do it. Okay, so let me know first, is the sound coming from up close or far away? Let's start close or far. Keep your eyes closed. Keep your eyes closed. Listen carefully. Is that sound close or far away? Take a guess in 3, 2, and 1. Good. That came from up close. Good job. Now let's do this again. Up close or far away. Ready? Let's go. Close or far. Keep your eyes closed. Close or far. 3, 2, and 1. Good. Far away. Let's try this again, but with a different sound. Okay, listen carefully. Up close or far away. I'm gonna get just a little tool here and we're gonna make some sounds with it, okay? So, up close or far away. Listen carefully, but keep your eyes closed, otherwise it'll be obvious. Let's start. Up close or far away. Take a guess in 3, 2, and 1. Close or far away. Did you get up close? Very good. Keep your eyes closed. And last time, close or far away. I know you want to open your eyes super duper bad, but keep them closed. Close or far. Let's start. Close or far. 3, 2, and 1. Close. Very good. Now another ear exam test. Let me know the moment you are unable to hear the sound. If you open your eyes, it will be very obvious, so keep those eyes closed. So, let me know the moment I stop making the hand sounds. Are you ready? Let's start. Listen carefully. When does the sound stop? Very good. Let's try again. cranial nerves, okay? So, I have 2 bottles of this like really good essential oils. These ones are edible. And one of them tastes like chocolate. And the other one tastes like a Sour Patch Kid, kind of like a cherry, okay? If you open your eyes, it'll be obvious which bottle is which. So keep your eyes closed and just use your sense of taste and smell to see which one you got. You could also get the same flavor twice, okay? So keep your eyes closed and let's start with this taste test. You either have chocolate or candy. I think it reminds me of cherry, so chocolate or cherry. Let's start. Let me grab a bottle at random. Here we go. Chocolate or cherry. Keep your eyes closed and say, ah, very good. Let's add 3 drops right here. Okay, and now just taste that. What do you think that one could be using only your sense of taste? Keep your eyes closed. Good, that one was chocolate. Very good. 2 more rounds. Let's see what you get. Let's choose a bottle at random. Good. Keep your eyes absolutely closed. Now, chocolate or cherry. Say, ah. Let's add 3 drops. Okay, and taste that. Good. And what does that one taste like? Chocolate or cherry? Keep your eyes closed. Good. You got that. That one was cherry. Good. Now one more round. We're gonna mix them up. Now chocolate or cherry. Let me choose a bottle at random here. Okay. So chocolate or cherry. Keep your eyes closed. Let's see which one you get now. Say, ah. Good. Let's add the drops. Okay, and taste that. What did you get? Chocolate or cherry? Keep your eyes closed, otherwise it'll be obvious. 3, 2, and 1. Did you get chocolate? Very good. Let's move on now to the smell test. I have 3 to 4 essential oils. It'll be extremely obvious if you open your eyes, okay? So keep those eyes absolutely closed because it will ruin the essential oil smell test, okay? So I'm gonna choose one at random and you have to take a guess what you think this essential oil smells like. We're just looking for basic answers, nothing in particular, you know? I'm looking for answers like, I don't know, like cherry. I'm not looking for answers like a perfume. So basic answers. If you smell cherry, it's cherry. If you smell strawberry, it's strawberry. Okay, let's start with this first one. Keep your eyes closed, otherwise it will be absolutely spoiled. Let's open this first one here to put right under your nose, okay? Now take a guess what you think that is. Breathe in and breathe out. What is this essential oil? You're getting mint. Okay, what else? You're getting candy. That's perfect. And you're getting something that's like refreshing, maybe even cooling. Okay. Any guesses what this could be? 3, 2, and 1. Eyes closed. Good. It's actually mint. This specific one is peppermint, so you're on a roll already. Good job. Let's write the details of that down. Okay. Are you ready for the second one now? Keep your eyes closed. Good. This next one is a little bit odd, but I think you'll get what the basic note of it is. Here is the first one. Keep your eyes closed. Let's open this essential oil up. I love this one, honestly. Now breathe in and breathe out. Breathe in and breathe out. Any guesses? You got floral. Good. And what else? Okay, a little bit of maybe like soap. That's perfect, like hand soap. Okay, any guess? 3, 2, and 1. Good job. This one was floral. Keep your eyes closed though. This one's actually called jasmine. Jasmine smells like it's often used in perfumes, lotions, and hand soaps. In fact, it's actually quite frequently used for cleansing products. And it is a flower, so you did great. 2 more left. Are you ready for the next one? Good. Okay, let's choose this one at random. You're doing great. Please keep your eyes closed. Okay. Good. So, this next one, I think you'll get immediately. Most people do. Okay. And now, keep your eyes closed. Here's the third one. And open that up. Oh my gosh, that one smells so good. So, it's under your nose. Breathe in. Keep your eyes closed. Breathe out. You got this one really fast. So, citrus, lemon. It smells like fruit and orange. Okay. You already got the answer. So 3, 2, and 1. Good job. Orange. You did great. Are you ready for the last one now? Okay. Keep your eyes closed. I'm analyzing your results. It looks like you almost opened your eyes the last time. I'm watching you, okay? Keep your eyes closed, my friend. Otherwise, you gotta redo this exam in the morning. I don't want to do it again. Okay. We're on to the last smell now. Keep your eyes closed. This one is a fan favorite. People love this one. Just keep your eyes closed. And what does this last one smell like? Breathe in and breathe I almost saw your eyes open. What's the guess? Very good. It's a flower. It is lavender. You did great. Good job. We're going to finish off here with one last test. We have a sharp or a dull test. And I have a tool here that has two sides. One side is the soft one, and the other side is the sharp side. Just let me know if you think the side I'm using on your face is soft or sharp. Okay, let's start. Absolutely keep your eyes closed because it will be super obvious. Let's go. So, sharp or dull? Let's start. I'm just going to poke, 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 poke. Take a guess. 3, 2, and 1. Soft. Very good. Let's try again. Keep your eyes closed. And what is that? 3, 2, and 1. Sharp or dull? Sharp. Very good. One more time. Are you ready? Let's start. Sharp or dull? Keep your eyes closed. I see your eyes kind of opening. Keep them closed. Good. Good. Keep your eyes closed. Good. Keep your eyes closed. And what's this last one? Sharp or dull? 3, 2, 1. Very good. It was soft. It was the dull side. Okay. Now keep your eyes closed. I'm going to finalize some of these results now before the doctor sees you and sends you off to the sleep laboratory to get your sleep results. Now, you opened your eyes a little bit. You were absolutely slightly tempted to open your eyes. I will share those results with the doctor. And if we need to retest, we will have this on a video spectrum ready for you to replay. But if you did open your eyes, you have to redo this. I'm going to be completely honest with you here, okay? Now, we're going to send you this to the sleep laboratory room, and the doctor will come into this room and they will tell you exactly all your results from this test today, and then we'll send you off to do a sleep analysis to make sure we find out when things help you sleep best, okay? Okay. Again, I am Nurse Cece. It's a pleasure to meet you, and I might have to retest you in the morning, okay? But you gotta let me know. Did you keep your eyes closed? Okay. I'll write that down. And repeat this if you did open your eyes, okay? I'm gonna close and write some notes now and have